Infection control in outpatient behavioral setting. Infection control basis. The ultimate goal of an infection control program is to prevent the spread of pathogens. The Center for Disease Control and Prevention, the CDC, has identified four basic components of infection control in a healthcare setting. Following each component is the URL to access the 2017 guidelines: disinfection and sterilization, environmental infection control. This is for you to go ahead and look up as you feel needed. Again, continue. Hand hygiene and isolation precautions. Disinfection and sterilization. Company policy will dictate any disinfectants and/or germicides to be used by personnel and when they are necessary. Housekeeping, Environmental Services, the EVS, is primarily responsible for terminal cleaning. Personnel are always expected to clean up after themselves, follow appropriate hygiene techniques, and maintain a sanitary environment. Any issues regarding client activity, such as leaving, refusing, failing to follow proper hygiene techniques, or attending the program with obvious illness, should be addressed with a supervisor and/or administrator. Environmental infection control during construction and renovation. In the outpatient setting, the most common need to activate environmental infection control standards is during construction and/or renovation. The CDC has published guidelines regarding maintaining good infection control during construction and/or renovation. The guidelines dictate how to prevent the transmission of dust particles, fumes, and any other airborne foreign bodies. Portion and seal off any area under construction or renovation. Ensure that the HVAC system are not operating in a manner to spread particles or fumes. And understand the risk of chemicals or points being used. Hand hygiene. Many infection control authorities, including the CDC, the World Health Organization, which is the WHO, and the Association for Professionals in Infection Control and Epidemiology, the APAC, recommended the use of alcohol-based waterless hand sanitizers, either ethanol or isopropanol, as a primary method of maintaining good hand hygiene. Washing hands with soap and water is an acceptable method of hand hygiene and is required for the presence of the observable dirt or contaminants. Personnel in outpatient settings are required to practice hand hygiene in at least the following situations, and more often are necessary. Waterless hand sanitizers. The following is true of waterless hand sanitizers. 1. Efficiency has been proven in products that are at least 62% alcohol-based, ethanol or isopropanol. The higher the alcohol content, the more effective. 2. Alcohol-based hand sanitizers should not be readily accessible to behavioral health clients, as they may present many risks. And 3. Personnel are encouraged to carry small containers of alcohol-based hand sanitizers on their person and use them frequently. Washing our hands. For hand washing to be effective, it must be conducted properly. Number 1, wet hands with warm running water. Number 2, apply your soap. Number 3, vigorously scrub hands for at least 15 seconds. Clean under your fingernails and between your fingers. 4, rinse thoroughly under running water. 5, dry hands with proper towel, hand air dryer, or clean fabric towel. 6. Use proper towel to turn off water. 7. Use proper towels to open the door if it's applicable. The length of the time to sing Twinkle Twinkle or the alphabet song. Isolation precautions, that's IS. The CDC contains a committee, the Healthcare Infection Control Practices Advisory Committee, HICPAC. HICPAC provides updates on isolation precautions and other practices as applicable. Current isolation precaution guidelines were developed in 2007, but have a number of updates as recent as 2017. Isolation guidelines are pathogen specific and are specific to the mode of transmission. Standard precautions, SP, combine the major factors of universal precautions, UP, and body substance isolation, BSI, are based on the principles that all blood, body, body fluid, secretions, excretions, except sweat, non-intact skin, and mucous membranes may contain transmittable infection agents. Includes a group of infection prevention practices that apply to all patients, regardless of suspected or contaminated infection status, in any setting in which healthcare is delivered. Standard precautions involve the use of appropriate PPE as determined by the nature of the client staff member interaction, the extent of anticipated blood, body fluid, or pathogen exposure, and the contamination of equipment that is to be handled. PPE stands for Personal Protective Equipment. Depending on the circumstances, settings may type of PPE are available. This includes gloves, gowns, face shields, masks, and goggles. In the behavioral health setting, the most commonly used PPE is gloves. In accordance with policy, it is recommended that staff members wear gloves for their own protection and to reduce the risk of pathogens transmitting when engaging in direct contact with clients' belongings, trash, food, and body fluids. Important reminders about the gloves. It is important for staff members to change your gloves between tasks and or patients. Remove contaminated gloves and dispose of them appropriately before touching an item. Engage in hand hygiene immediately after removing or when changing your gloves. Gloves must be disposed of as soon as they are removed from the hands. Gloves should be disposed of in an appropriate trash receptacle. Red bags are not required. Using the proper techniques for removing contaminated gloves will decrease the chance of exposure to pathogens. New elements of SP. 3 new elements have been added by HICPAC based on increasing protection of the patients. Respiratory hygiene, which is cough etiquette for the individual with cough, congestion, and or increased respiratory secretions. Development of this element occurred as a result of the 2003 SARS outbreak. Number 1, we're going to education of the staff members, the patient and staff member. We're going to post signs in languages appropriate to the population served with instructions. And 3, source controls measured such as covering the mouth, nose with a tissue when coughing or sneezing. Properly dispose of used tissue. Using a surgical mask on the individual that presents signs of a respiratory infection when tolerated or appropriated. Hand hygiene promptly after contact with respiratory secretions. Spatial separation from the infected individual at least 3 feet when possible. This eliminates especially important during the flu season. New elements of SP-safe injection practices. As this element involves procedures never performed in an outpatient behavioral health setting, no details will be given. Safe injection practices is an element that was adding following 4 large outbreaks of HPV and HCV among patients in ambulatory care medical outpatient facilities in the U.S. Number 1, safeguards developed as a result include the recommended use of a single-dose vial, the recommended use of a single-dose disposable needle, and the advent of the self-shearing safety needle. New elements of the SP-safe injection practice. As this element involves procedures never performed in an outpatient behavioral setting, no details would be given except to say that in 2004, outbreak of post-malarial meningitis promoted the CDC to investigate and develop new infection control guidelines. Clients on transmission-based precautions. Clients on transmission-based precautions will not generally attend outpatient programs, although a client requiring droplet precautions may attend if he or she wears a mask and practices good respiratory and hand hygiene. Transmission-based precautions remain in effect for limited people of time, either while the risk for transmission exists for the duration of the illness, depending on the pathogen of the patient. For some diseases, such as TB, state law and regulations exist that dictate the duration. Immune-compromised clients may continue to be infectious beyond standard time procedures. If you suspect that a client may require transmission-based precautions, please notify your supervisor. Healthcare-associated infections, which is HAI, has replaced the term nosocomial. Includes infections presumably acquired in the healthcare setting. Unless an outbreak of an illness occurs in a number of individuals whose only contact occurs in the outpatient setting, it is unnecessary for a behavioral health outpatient setting to monitor HAI activity, healthcare-associated infection. If you suspect an HAI outbreak is occurring, please notify your supervisor. Behavioral health. Epidemiologists of the Louisiana Office of Public Health, OPH, and the Louisiana APIC have determined the following. Behavioral health setting has a potential high incidence of insect infections. It is beneficial for personnel in the behavioral health outpatient setting to be familiar with S&S of insect infestations. Training will be provided as appropriate. Infestations may include, but again not limited to, bed bugs, lice, head and body, or scabies. Assessment for infection and behavioral health. Although screening for S&S of infection upon admission is critical and should include questions about fever, respiratory S&S, diarrhea, UTI S&S, TB standardized screening, abscess rashes, spider bites, insects. Employee infections. Employees should not come to work if, within the 24 hours they have had a temperature higher than 99.4, have vomited or had diarrhea, liquid or watery stool, have severe respiratory with a lot of respiratory secretions. Employees must notify a supervisor if diagnosed with a specific infection pathogen, example, influenza, strep, norovirus, etc., the flu. They have an exposed area of skin with an abscess, example, spider bite, or an obvious infection, a rash or dermatitis, an open wound. Reporting infectious diseases. The Louisiana Office of Public Health has an epidemiology program designed to accept reports uh, via telephone 24/7. The phone number is 800-256-2748, or you can fax them at 504-568-8298. Here's the forms also that you can report to infectious disease, what's going on, and also the Louisiana Sanitary Code requirements. Isolation precaution. The guidelines provide general recommendations regarding risk posed by visitors, the use of immunizations, PPE, and standard precautions.
We have reached the end of this training. Please complete the post test. Thank you.